My name is Rachel Tiefel, and I'm a clinical assistant professor at Purdue University and a board-certified family nurse practitioner. Endometriosis is a condition where the endometrium, or the lining of the uterus, grows outside of the uterus. This is commonly to the ovaries or the fallopian tubes, but it can also make its way out to the bowels or bladder. This tissue outside of the uterine cavity can cause pain and inflammation. So symptoms with endometriosis include chronic pelvic pain, increased bleeding and pain during your menstrual cycle. It can lead to pain with bowel movements or when you're voiding. It can also lead to infertility. Endometriosis impacts about 10% of women in the population, which equates to about 190 million. So it's a very common condition, and chances are someone you know or love is living with this condition. While there's no cure for endometriosis, we can work to manage symptoms. So it's important that we manage pain and inflammation. We use things like naproxen or ibuprofen to manage those. We can also use hormone-based therapies like the birth control pill, the ring. We use those to decrease estrogen, which can decrease the amount of symptoms that women are dealing with. We also have surgical interventions, so a laparoscopic surgery to remove endometrial tissue. We can also move on to a full hysterectomy if pregnancy is not the ultimate goal for the patient. It's important that we raise awareness about endometriosis because there's a critical gap between patients having symptoms and being diagnosed. Sometimes it's 4 to 12 years before a patient is diagnosed with endometriosis. It's really important that we teach women what the symptoms are so they can advocate for themselves to their healthcare provider so we can close critical gaps in the healthcare system and meet the needs that women have in terms of reproductive health. By talking openly about endometriosis, we can reduce stigma, increase access to care, and make sure that women that are dealing with endometriosis can feel heard, believed, and have the care that they deserve. I feel like this is so important because so many people that deal with endometriosis deal with it in silence. They don't know to go seek health care, so they end up in a situation where they feel alone. So it's important that people are supported when they're dealing with these kind of struggles, when they're having pain or increased bleeding and they're not sure what's going on. They need to know that they can go see their healthcare provider and they can advocate for themselves.